Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, using metronidazole to treat bacterial vaginosis, bacterial vaginosis, BV, is a common bacterial vaginal infection affecting roughly 30% of women ages 14 to 49 in the United States. This infection occurs when bad bacteria outweigh good bacteria in the vagina. /r/n/r/n 84% of women with BV do not have symptoms. When symptoms are present, the most common is a strong fishy vaginal odor and an increase in vaginal discharge. /r/n/r/n Metronidazole, such as the brand Flagyl, is an antibiotic used to treat bacterial vaginosis. This article reviews the basics of metronidazole, dosage, side effects, effectiveness, other medications for BV, and more. /r/n/r/nPixelsEffect, Getty Imagesrnrn Metronidazole is considered the first line of treatment for BV. This means it's one of the preferred antibiotics used to treat BV. /r/n/r/n Metronidazole is the generic version. Brand names include /r/n/r/n Metronidazole comes in capsules, tablets, pills, creams, gels, and intravenous, forms. It can be given orally, by mouth, vaginally, or intravenously. Prescriptions to treat BV are typically for oral or vaginal administration. /r/n/r/n Both oral and vaginal metronidazole are safe to take while pregnant and breastfeeding. However, healthcare providers often prefer vaginal cream since the medication does not distribute throughout the body as much as it does with oral medication. /r/n/r/n The following are typical dosages for metronidazole when treating BV. /r/n/r/n Sometimes, healthcare providers will prescribe oral and vaginal medications for you to take simultaneously. They might also increase the dose or time you take the medication, especially if the infection returns after initial treatment. /r/n/r/n When your healthcare provider prescribes metronidazole or another antibiotic, it's important to take all the medication, even if the symptoms cease. Stopping antibiotics too early can cause the infection to return and for you to build resistance to the antibiotic. /r/n/r/n Common side effects of metronidazole include /r/n/r/n Less common side effects include /r/n/r/n Taking metronidazole with food helps decrease the risk of stomach upset, including nausea, vomiting, and abdominal pain. Stomach upset is less common with vaginal metronidazole compared to oral administration. /r/n/r/n Metronidazole can interact with the following medications. /r/n/r/n Vaginal metronidazole can increase your chance of getting a yeast infection. Your provider may prescribe Diflucan, fluconazole, by mouth or probiotics to decrease this risk, especially with extended treatment. /r/n/r/n Metronidazole vaginal cream can weaken birth control methods such as latex condoms and diaphragms. It's best to use another form of birth control during treatment and for 5 days after treatment is complete. /r/n/r/n Some studies show a cure rate of over 90% after 1 week of treatment and 70% to 80% after 4 weeks. /r/n/r/n There is some concern that metronidazole alone may temporarily balance the bacteria in the vagina, but the risk of recurrence is high. Adding probiotics along with antibiotics is becoming a more common practice. Probiotics can help with a more permanent or long-term solution to balancing the vaginal flora, microorganisms. /r/n/r/n The following people should avoid taking metronidazole: /r/n/r/n One of the following antibiotics may also be used to treat BV. /r/n/r/n While not as common, Xifaxan, rifaximin, may also be prescribed for BV. /r/n/r/n. Your healthcare provider may also consider the following alternative treatments, either alone or with antibiotic treatment, /r/n/r/n. Recurring, returning, infections are common after treatment of BV. In fact, 50% of women get another infection within 12 months of treatment. BV is considered recurring when a woman has at least 3 infections in 1 year. /r/n/r/n. If you have a recurring infection, your healthcare provider may increase the dose and time you take antibiotics. Sometimes, they prescribe a maintenance dose of vaginal cream to help prevent a recurrence. /r/n/r/n. It's best to avoid sexual contact until treatment has ended and your symptoms have resolved. If your intimate partner is a woman, they should seek treatment as BV can spread between female sex partners. However, if your intimate partner is male, research does not indicate that they need treatment. /r/n/r/n. The following guidelines can prevent or reduce the risk of bacterial vaginosis: /r/n/r/n. Bacterial vaginosis, BV, is a common bacterial vaginal infection that occurs when bad bacteria outweigh good bacteria in the vagina. Metronidazole is an antibiotic used to treat BV. It can be given orally, by mouth, or intravaginally, inserted into the vagina. The most common side effects are stomach upset. /r/n/r/n. Metronidazole is highly effective, but the chances of the infection recurring are high. In this case, healthcare providers may prescribe higher doses for longer, both vaginal and oral medication together, and probiotics to prevent a recurrence. /r/n/r/n. Alternative antibiotics and other treatments, such as boric acid, vaginal vitamin C, or sucrose gel, may also be suggested. /r/n/r/n. Having bacterial vaginosis can be inconvenient, frustrating, and embarrassing. It can occur and reoccur even when you have been trying your best to prevent it. Finish the entire metronidazole prescription for BV. Not taking all of it can increase your chance of recurrence or resistance to the antibiotic. /r/n/r/n. Symptoms usually start to resolve after taking metronidazole for a few days. For some, it can take a couple of weeks. It's important to take all antibiotics even if the symptoms are gone. Not taking all of them increases your risk of resistance to the antibiotic and a recurrence, return, of the infection. /r/n/r/n. When metronidazole is prescribed orally, by mouth, the initial treatment is usually 500 mg twice daily for 7 days. The intravaginal dose is typically 0.75% gel, with 1 applicator for 5 nights. Sometimes healthcare providers will prescribe both oral and vaginal medication or increase the dose and time you take the medication. This is especially true if the infection returns after initial treatment. /r/n/r/n. Yes, sometimes BV resolves on its own. Some women don't realize they have BV because they never have symptoms. For others, symptoms may come and go. It's best to seek treatment anytime you have symptoms. This helps decrease your risk of getting sexually transmitted infections, STIs, or other complications of BV. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.